You know, Dr. Hendricks, I understand liposuction can be very messy once a patient leaves the surgery center and goes home to heal. What is the recovery process for that? And is there anything they can do so that that's not so messy?
Well, very good question. I agree with you. I've heard some really horror stories about people who have had liposuction. They've gone on consultations where the doctors or the patient care coordinators told them that you will ooze fluid and you should put a shower curtain on your mattress because you're going to ooze fluid, or you need to
trash bags
right,
on the
or
chairs when they go home.
Exactly, or you need to get adult diapers. I can't imagine putting on adult diapers every day after having a procedure like this and just walking around dripping fluid. I was inspired to look for a better way. I really had no idea what patients were experiencing unless you experience it firsthand. I went to see a patient who was staying in a local hotel, and this was about a day after liposuction. And she was staying in a hotel suite, and I was looking at her, chatting with her in the living room part of the suite, and I looked over into the bedroom, just through the bedroom door, and it looked, the bed sheets looked like just a horrible mess. And I said, you know, there's got to be a better way. There has to be, because this is really not acceptable. There's a really simple solution. I won't give it away over the video, but it's a really simple solution. There's a particular type of dressing that you can place on this, and universally, once you put it on, it seals, and there's no fluid leak. And I take this dressing off at 10 days, and when I take it off, it's a little patch, but when I take this off, the little stitch I've used to close the opening is melted, and everything is healed underneath. Now, there are doctors who have tried to excuse or explain away the need for drainage. Like, you'll get better faster, or your swelling will get better sooner if you allow this all to drain out. There's not a single piece of evidence, scientific evidence, to prove that that's the case. We know very consistently through thousands of papers that an open wound that's exposed to the environment is much more likely to get an infection than a wound that's covered with a dressing. So if fluid can get out, bacteria can get in, and it's a much higher risk of developing an infection. So there's really no benefit to having it drain, having it open. Your body resorbs the fluid within a few hours. So, you know, there's really no validity to that. It's a fantastic improvement, I think. And my patients don't experience that. They don't experience that mess or that fear. It's usually a lot of water with a few drops of blood, but it looks like blood, and people have called me in days past and thought that they were hemorrhaging, or, you know, had real worries about that. It was a terrible aftermath of having a liposuction procedure, but we have that no more.